And women go on with this incontinence for a very long time without telling people. So you can imagine when a woman gets pregnant, how the abdomen gets stretched, and that abdomen is never back to normal. And if you are in a situation where it is not practically possible to urinate, brain sends a signal to the bladder saying that time is not right, hold.
What is the treatment? How is it possible? And to what extent is this curable?
That, although we can give some medications to kind of make the bladder contract a little better.
Till what age do you think surgeries are safe, especially for urinary incontinence?
Yeah, no, age is not a factor for surgery.
Okay.
It's the fitness of the patient.
Hello everybody, welcome to another episode of Womanaari, and today I am going to be discussing a topic that I know very little about. I've heard about it very briefly. The topic is called urinary incontinence, and yes, it's a difficult word, but I think when we understand what are the symptoms, you'll go like, oh, I know people around me have these symptoms. And to discuss this topic more in detail, how it affects women's health, when does it happen in a woman's journey, and how do we treat it, let us consult our expert consultant gynecologist, Dr. Usha Kiran, on the show. Hi, Dr. Usha. How are you doing today?
I'm good, Diksha. Thank you.
Great. So, complicated word. I'm fumbling saying this out loud. Urinary incontinence. What is this issue? Hai kya hai?
So, urinary incontinence is nothing but urine leakage. So, normally urine is not supposed to leak when you don't want to go to the loo. Okay. So, in some women, urine can leak involuntarily without them wanting to do it and then wet their clothes. It could be small amounts, large amounts, which can be a very embarrassing situation. So that is urinary incontinence.
But is that common? Do many ladies go through this?
You will be very surprised. Now, because it's such an embarrassing issue, people don't actually admit it. But there are quite a few women who suffer from it. And this podcast is very near and dear to my heart because I would like to create more awareness that you're not the only one who's suffering. If you're suffering from urinary incontinence, there are many women like you. And treatment is possible. So the best bit is that it can be completely cured. And women go on with this incontinence for a very long time without telling people. And you won't believe it that about 40 to 50% of women who are either post-delivery or post-menopausal or in the perimenopausal group of women will have some kind of incontinence.
My goodness. I didn't know that the figure was so staggering, but I understand that because it's a topic where, it's embarrassing, like, oh my God, I can't control my urine. That happens. Because, I generally think that, or maybe I used to think, let's put it that way, that only people in their really old age, when they have no control over their body, when they're, pretty much in the vegetable stage, only then it happens.
No, that's not true actually. That's not true. So if you kind of spoke to a woman over 40s, in their 40s, who have had children, I think almost 80% of women would have leaked at least once or twice, if not every day. So it is very common.
Interesting. Well, thank you. And let's talk about why is it more common during childbirth or after childbirth and, during menopause and so on. Why does it happen?
So basically in the pelvis, that's in where the uterus and your bowel and bladder, everything is there. There is a muscle called a levator muscle, which acts like a hammock, on which your uterus is sitting, your bladder is sitting, and your rectum, the bowel, is sitting. So this muscle during childbirth gets stretched to a large extent. Imagine allowing a 10 centimeter head of the baby to come through. So it's like the aperture is this much, and then it goes this much. And then like any other muscle, so you can imagine when a woman gets pregnant, how the abdomen gets stretched. And that abdomen is never back to normal, whatever they say, okay? So similarly, the pelvic floor muscle, which is the levator muscle, which gets stretched to a large extent. And the more it gets stretched just in pregnancy, holding the weight of the baby, which is going to be 2-3 kilos constantly for 9 months. And then during the delivery, it gets more stretched. So the more pregnancies you have, the more deliveries you have naturally, the chance of your pelvic floor becoming weaker is much more. However, there comes in the genetic factor as well. So not every woman who has a normal delivery will end up having a prolapse. There are women who have had 5-6 deliveries and they're fine, they don't have a prolapse. So inherently also how your muscle is and what your tendency for the muscle weakness also matters.
My goodness.
And menopause decreases the hormones, and the aging can make it even worse.
I agree. Must be. Are there any different types of urine leakage issues?
Yes, so so as I said, one is the pelvic floor weakness, where the muscle is sagging. So the bladder, which is sitting, urinary bladder, which is sitting on the muscle, is also sagging. So the angle of the neck of the bladder and the bladder itself gets affected. So a part of the continence comes from the angle, which is lost, and then people can get leaks while they cough, laugh, or do some exercise, lift some heavy weight. So suddenly they feel the urine is escaping. So that is what we call it as a stress incontinence. Then you have the other type of incontinence, which is also common as you grow older and lack of hormones, which is called where the bladder becomes very irritable for whatever reason, because of the lack of hormones. Due to the thinning of the lining of the bladder, because of the lack of hormones and aging, it becomes more irritable. So whatever urine is in there, it starts becoming, it starts irritating it. So the bladder muscle starts contracting to pass urine. Normally, a bladder should hold urine up till 300-400 ml of urine, and then you get the first urge to urinate. And if you are in a situation where it is not practically possible to urinate, the brain sends a signal to the bladder saying that time is not right, hold. So the bladder starts relaxing. Now it reaches again maybe around 500-600, then again you get the urge. You've realized that, I'm sure, at some point when we are traveling especially, I want to go to the loo, but there's no toilet around, so okay, let's stop at the next service station, and then you're holding. So and then comes the second urge around 500-600, then you're like, I really need to go, or there's still no service station ahead, so we say okay, hold. But this comes a point where you're like 900,000 ml is accumulated in the bladder, and you're like, I'm going to do it now here. Correct. Whether there is a service station or no.
Right.
Okay, so bladder has got a capacity to extend to almost 1,000 ml. That's 1 liter of urine. Now, in people with this kind of bladder irritability and incontinence, they hardly hold about 50 to 100 ml of urine, and then the bladder starts going like that, and then they go. So they're passing very small amounts of urine, but they're running and rushing to do it.
Correct.
And it can so happen that they're almost rushing to the toilet, and before they reach, it kind of comes out. So which again is extremely embarrassing, especially for women who are working. They're sitting in the office, and anytime and every time they want to rush to the
Correct.
loo, and then they can get wet even otherwise. That's one of the type. We call it as the detrusor incontinence, or the bladder irritability, or the urge incontinence. Now there comes a third type of incontinence also, wherein when people for whatever reason have had either a vaginal delivery which went wrong, where the head was pressing too long on the vagina, and actually it created a hole later on in the vagina and the bladder, they can continuously leak urine through the vagina. So this is like they're all the time wet. It's kind of a incontinence, which is like a fistula is formed. That's a continuous incontinence they can get. And this can happen in women who have had cancer, who have had surgeries where there was damage to the vagina or the bladder, or in terms of when they receive radiotherapy for the cancer. That can also cause this. Then comes a different kind of incontinence, which is not a very common one, where we call it an overflow incontinence. The bladder gets full and then it starts coming out. That's also one of the things. But the common ones in the age group of women who are 40s and 50s is the stress incontinence I talked about, where the bladder neck is weak, and also the urge incontinence, where the bladder has become very irritable. These are the two common incontinence problems that we see.
And I'm sharing this I've not gone on camera and shared this, but for me, I've always seen my mother rushing to the washroom. Whenever we would go to anyone's house, she would first go into the washroom.
Yeah.
Then if we are going to a mall, sabse pehle washroom mein. Even if the distance between the house and the mall is just 20 minutes, and she'll do. And we used to always just laugh about it. अरे मम्मी को तो कोई काम नहीं है, bathroom हर जगह जाना, bathroom में जाना and so on. But could actually this be a urinary incontinence problem?
Yeah, this is the bladder irritability when I call it the urge
Right,
incontinence.
the urge one.
So this is the most common in most of the women. Above 40, you see majority of the women, or like you said,
Correct.
anywhere they have to go first.
First
they'll
they'll
go to the
look for
toilet.
the toilet,
Okay,
yes.
they go for a go to the loo, and then anywhere they go, they're looking for, is there a loo around?
Correct.
You know, their whole life is like centered around finding a loo
Yes,
nearby.
yes.
And it kind actually, although it is funny, like you said,
You're
kids
right.
would think that, you know, mummy is all the time running to the loo.
Right.
It is a very stressful situation.
Absolutely.
Now, what happens in these women is, because they are so loo-centered now, their life is loo-centered.
Correct.
So what happens is, they start drinking less water.
Yes, my mom does that. She doesn't drink tea.
Yeah.
After some point in time, she's like, the more I drink tea, the more I'll, you know, want to
And
urinate.
also even the water they start reducing. Okay. Now once they start reducing, and anywhere they want to go, that they are like, you know,
Conscious
like,
about,
"Us din
yes.
दोपहर से कुछ नहीं पीना खाना."
Yes,
Like, you know, you
yes.
just keep your bladder empty. And then in the night, if they have to get up more number of times, they stop drinking water in the night as well, like before going to bed. But this actually works against them. So what happens is, the less you drink, the urine is much more concentrated and acidic, and it actually burns the bladder more, and it kind of irritates the bladder. Already the bladder is irritable. You can imagine if you have a raw wound and you pour some salt on it, kind of a thing. So the bladder is already irritable, and you reduce the amount of water, you make the urine concentrated, the bladder gets even more irritable. So
Totally.
it becomes a vicious circle,
Yes.
and they're stuck in this zone where they don't know what to do about it.
And you know, I mean, for me, I didn't even know that this is a problem. Let's put it that way. I used to think, but it's just some people just, you know, who need to urinate more, others don't. You know, it's just that thing. Because I'll tell you, I'm giving you two extreme examples. My sister is one of the kind. She will leave home in the morning and she will not pass urine during the day anywhere. She'll like, मुझे मेरे घर में ही चाहिए, मैं बाहर कहीं नहीं जाऊंगी. You know, that's his thing. And then there's my mom who wants to go everywhere. Okay, now let's talk about.
No, I wanted to say something about that. Like you said, you're not even aware that it was a problem.
Correct.
Forget about you and the people around, like the kids and the husband.
Yes.
They generally think that, अरे इसको तो कल bathroom ही जाते रहना है.
Correct,
You know,
correct.
that's the attitude. But forget about those people. The woman who's actually going through this also thinks that this is herself.
Correct. My body's
You
like
know,
this.
she thinks that अरे मैं ही ऐसी हूँ.
हाँ मैं ही ऐसी, मेरी बॉडी ऐसी है.
हाँ, मतलब कि ऐसा कोई प्रॉब्लम है इसके लिए नहीं, इसको ट्रीट करना चाहिए इसे नहीं, अरे मेरा वैसा ही है ब्लैडर. Which is a sad part, that people think that they have to live with it because that's how they are. That's how they are not is true. The bladder has reached a point of irritability. It can be reversed back.
Okay. Now I generally want to know about the treatment. What is the treatment? How is it possible? And to what extent is this curable?
Okay. Now, as I said, there are two kinds of incontinence. The common ones that we are seeing, the stress one, where the bladder neck is weak. That, although we can give some medications to kind of make the bladder contract a little better and hold the urine, the mainstay of treatment for that is surgical, where we actually put in a tape or a few stitches and elevate the neck of the bladder, which is sagging. So it's as good as if your face is sagging, you have a facelift. So your bladder neck is sagging, you have a bladder neck lift, which is surgical. Okay. There are treatments like laser vaginal tightening treatments, which can also help with the incontinence. But honestly, the incontinence part of it has to be very minimal. And also in young patients who have just had a childbirth, for them a bit of pelvic floor exercises and a bit of laser might do the trick. But not for somebody who's perimenopausal, who's having large leaks. Not for those people. So the laser and the physiotherapy, honestly, we advise physiotherapy for everyone, but it doesn't generally do much. So physiotherapy involves the Kegels exercises, where you're trying to contract your pelvic muscles and release. So like any other muscle. But it can prevent, if you start doing it as a preventive measure, it prevents things from getting worsened, but it doesn't cure back the problem which has happened. So surgery is the only way to cure that. Surgery is very simple. As I said, it's a tape operation or a stitches, which can be like done as a day case or just a one-day stay in the hospital. Everything done from below, no cuts on the abdomen, anything.
Very well.
Coming to the second part of the incontinence, the urge incontinence we're talking about, which is actually much more common than the stress incontinence. This wanting to rush and run to the toilet.
Yes.
That can be done with medications and with what we call bladder training. Okay.
Achha.
Now, medications can be given temporarily because the bladder has already become irritable. We need to kind of relax the bladder. So, the medication helps to relax the bladder.
Correct.
And then you can't, I mean, at least I tell my patients, you can't remain on medications for lifetime. We want some kind of a cure which is without medication. So, what do? You do something called bladder training. Bladder again is a muscle. So, muscles can all be trained in the body. All you have to do is drink more water, let the muscle stretch, hold your urine. Today you hold it for 2 minutes extra, tomorrow you hold it for 2.5 minutes extra. So what I tell my, it's easier said than done because they're worried about the leak.
Correct.
Okay, so what I tell my patients is when you are at home, forget about when you're going to the
malls
going
or
to
anywhere outside,
work
yes.
or anywhere out.
Yes.
But when you're actually at home, wear a pad. Even if you leak, it's okay, you can always change. You can change the pad, you can change your clothes. So you know that it's not an embarrassing situation. So try and hold your bladder. So start writing a bladder diary. You went to the loo in the morning this much. Drink lots of water. Let the bladder stretch. When you get the urge to go, start putting on a music or divert your mind. Start watching something on the YouTube or whatever. Do something else so that the mind gets diverted, even if it's only for a minute to start off with. And then walk slowly to the bathroom. Don't rush. Oh, abhi ho jayega. No. Say, I'm going to walk. It's okay even if I leak on the way. If you go with that, then the bladder learns to stretch a little bit, half a centimeter today. Then tomorrow you have the confidence that you can stretch that bladder a little more. So do this exercise on a regular basis with the medication over a period of 3 to 4 months.
It gets
you
better.
would have actually started drinking more water, making your urine less acidic, and you've started stretching the bladder. It will go back to what it was normal. So that can happen. Of course, we have to make sure that there is no infection because many times there are trigger factors which lead to this. If there is a urine infection which has led to this and they're getting repeated urine infection, the bladder training won't help. So we need to treat that. So once all that is done, bladder training can actually completely cure these patients, and over a period of 3 to 6 months, they can come off the medication if they want to.
Oh wow, that
Which
is
is good.
That is a good
Yeah.
thing. Yeah. Because I mean, see, I'll just bring back my mom's example. My mom's very scared of surgeries and so on at this age. She's 61. Okay, till what age do you think surgeries are safe, especially for urinary incontinence?
Yeah, no, age is not a factor for surgery.
Okay.
It's the fitness of the patient.
Okay.
So you can have somebody who is 40-year-old who is a diabetic and a hypertensive and a cardiac problem. They're not fit enough as compared to a 60-year-old who is actually fit and well. So it's the fitness which matters. Of course, with the aging body, age per se is not a thing. Of course, with age, with the age and the recovery period, everything gets prolonged.
Yeah.
So it's more of a you assess how mobile the patient is, how fit they are looking, how fit they are in terms of organ systems, and then offer the surgery. If somebody is not at all mobile much, they are having various other issues, then surgery is not the first thing to do.
Okay, all right. And you also talked about the pelvic floor therapy, which was said that, for some ladies, what is this pelvic floor therapy and is it actually effective?
Yeah, so as I said, it is effective in preventing. So every woman should generally do Kegels exercises, pelvic floor exercises, irrespective of whether they have given birth to child or they're menopausal or they're young, because it's like training if you're training your biceps and it remains good, similarly if you train your pelvic floor, it remains good. So doing Kegels exercises should be a part of your lifestyle rather than trying to do it as something like a treatment. As a treatment, honestly, it doesn't work very well.
Okay, but you
As
actually
prevention-
recommend doing it all throughout your life?
Throughout, yeah.
On a regular basis, so you don't have this.
So you get, on the Amazon, you get these Kegels balls as well, okay. So which have a different size and weight in it. You just put it into the vagina, inflate the balloon, and then you try to hold it. Now, if you can hold it, basically your muscle is gripping it, which means your muscle is getting stronger. If you can't hold it, then you need to use a bigger balloon or whatever, inflate, and then try to work from there and then get to the smaller. So it is much easier. Before we used to just say to the patient, do Kegels exercise, and we would teach them with 2 fingers in the vagina. We would say, contract your finger around my vagina. But when they went home, they would just contract their gluteus muscle and not contract the pelvic floor. So it would like not get anywhere. Nowadays we have these things which are called Kegels exercise balloons or weights from the Amazon people can buy.
My goodness, I get nervous anytime anybody mentions insert anything into your vagina or something, and I'm like, oh my god, that would be.
Well, probably for unmarried and not sexually
Yeah.
active people, I'm not advising. For somebody who's had a childbirth, I think
Correct.
inserting something into the vagina is not really such a big.
Not such a big thing. I agree with you. Also, talk to me about some lifestyle factors like diet, weight, or exercises that can actually influence such symptoms.
Yeah. So diet again, I think generalize having a healthy diet and keeping your weight down will improve the pelvic floor, because fat is a loose tissue. So when fat comes in between things, it makes everything else loose as well, the connective tissue loose. So less fat is better. But at the same time, if you're completely emaciated and really low on weight, that is also not good. So an average weight is good. Plus exercise. Now pelvic floor exercise is good, but if you're doing a lot of exercises which put pressure on your tummy, abdominal pressure and the pelvic pressure, that's not good. So if you already have a tendency for prolapse, or if you're having some kind of incontinence, if you start doing weightlifting, not good.
Correct.
If you start doing abdominal sit-ups, not good. So if somebody who wants to be active and who has a little bit of a weaker pelvic floor, what kind of exercises would I suggest? I generally tell them any weight bearing exercise, do them either lying down or sitting. Lying down better. So if you're doing the pecs, instead of doing this, lie down and do them. Lie down and do most of the exercise. There is no pressure on the pelvis as such. So that can be done.
Okay, interesting. That's some very good information. I also feel that doctor, especially with this issue, the urinary incontinence, it must be affecting the confidence of a lot of women, especially working women.
So it is very sad that people, one is they think that something is wrong with them and they can't tell anybody. And when they think something is wrong with them, they think it's them who is wrong, not some part in the body which is wrong, which can be corrected. So they don't tell people. And then if you're a working woman, it can really play havoc on your mind, because you're so worried, you're wearing a pad, you're doing everything, some people are wearing diapers, and you're all the time looking around if people are sensing the smell from you. Urine smell is really, really bad. And what happens is many times, people may not tell that you're smelling of urine, but they start slowly,
detracting.
They kind of
distance.
isolating these people, and
Yes.
if they don't want to talk to them, they don't want to be in the groups. So, and on top of that, they're already feeling guilty that they're smelling. So, any little bit of
Distance.
resistance from the group, they try to walk away. So, you can actually become a lonely, depressed person, and they start avoiding the parties. They start avoiding long travels. So it's almost like they just want to be at home. They don't want to go anywhere. So you can imagine what a sad life that will be. So urinary incontinence, although is a physical problem, can affect women's mental status to a large extent. So people who are at home should understand, if somebody is smelling of urine, then tell them, look, instead of ignoring and trying to walk away from them, or even at work, you should say, look, I think you have a problem. This problem is a sortable problem.
Correct.
Go see a doctor, you will be sorted. So that is very important for people around, to give that confidence to the person to go see a doctor to sort it out.
Is this problem even in males, or is it only a female problem?
I wouldn't know. Sorry.
Okay. Acha. That is a good
well, I
one.
think the male genitalia and the urethra, everything is slightly different.
Correct.
As compared to because the urethra, which is the tube that passes the urine, the end part of it, that is not inside the pelvis for them, it is outside. So, good you asked me, but I don't know the answer.
Okay. What are some of the things that people should follow? You obviously mentioned exercise, and that is one, and obviously the diet. Apart from that, is this tendency to not have enough water during the day, or the tendency to not drink any tea, coffee, etc., is that detrimental to your health?
Drinking tea, coffee is different. We generally advise women who are having urinary problems to avoid drinking coffee and tea, as compared to like we say, at least in the evenings, avoid
Yeah.
them.
Okay.
Or if you're going out, avoid tea, coffee, because tea, coffee acts as a diuresis, like it makes you pass more urine, but it drains the water from your body. So eventually you end up with, dehydration.
Correct.
So, which is not good for the bladder.
Correct.
So tea and coffee, if you're drinking 5 cups a day, I would say reduce it.
Reduce.
If you're drinking 1 or 2 cups a day, that's fine. That's not going to make much difference to you. But water, yes, most of the time nowadays, everybody is busy at work. So the tendency is not to drink much. Although now people are aware of it, many people carry bottles of water. But, majority of the times, for example, I'm very busy. I'm a very busy surgeon. And although there's water everywhere,
It doesn't strike. Pani pina, pani pina, pani pina.
Yeah, so basically what happens is, I've made it a point. I go to the OT in the morning. I drink 2 glasses of water. There's that water dispenser there, so I drink 2 glasses of water. I finish my case and come out. I drink 2 glasses of water. I go for another case. I drink. So I've kind of timed them with that way. And any outpatient, I do outpatients in different clinics. I go there. There's a water dispenser. Just have 2 glasses of before the outpatient, after the outpatient. But sometimes, in spite of consciously thinking, it doesn't happen. So drinking less water eventually will have an effect on the bladder. So
And that's not good. Okay, perfect. Okay. Very interesting, doctor. We had a very wonderful conversation. Thank you for opening our eyes and, sharing so much knowledge for everyone who actually considered urinary incontinence to be a problem that, it's not very common. Trust me, it is more common than you think. And I personally think that if you or anyone in your family, your parents, your siblings, or anyone else is going through this, it is important to tell them that it's okay and it's better to get it treated, and that the treatment is 100% possible. So for more such videos, please follow us on our Instagram channel. It's called Womanaari, and do subscribe to our YouTube channel as well for more such content on women health. Until next time, take care of yourself. Thank you. Thank you, doctor.
Thank you.